Senator Hassan.
Well, thank you, Chair Cassidy and Ranking Member Sanders, for holding today's hearing. Thanks to all of our witnesses for being here today. Before I get to my questions, I do want to take a moment to address the fact that we are still in a federal government shutdown. This shutdown is now in its fourth week, and I remain focused on finding a bipartisan solution to reopen the government and prevent a healthcare calamity. With due respect to my colleagues, a pro-worker president does not stand idly by while working people's health insurance premiums at least double. That is not what a pro-worker president does. In my state of New Hampshire, if we do not extend the ACA, the healthcare.gov premium tax credits, a family, a couple, 60-year-old couple earning $85,000 a year is going to see their premiums go up by at least $14,000. And that, of course, to Senator Hawley's recent point just now, is not sustainable. So, Ms. Turner, I want to start with a question to you. I've been a longtime supporter of the Protecting the Right to Organize Act, the PRO Act, which would strengthen collective bargaining and organizing rights for workers. What provisions of the PRO Act are top priorities for your members?
Well, first of all, it gives us the ability to freely organize without union busting tactics.
Right.
Okay?
Yeah.
And then secondly, the bill gives like real consequences to employers that violate labor law and try to detour us with union busting campaigns. And most importantly, it protects our nurses who are trying to unionize from being terminated or fired or harassment, because that's what's going on with our nurses that are trying to unionize. And so overall, like I said before, and I'll say it again, a union helps nurses to advocate for the patients at the bedside, get us better working conditions. And so this PRO Act is everything to the nurses. Yep. Because I'm fortunate in Minnesota, 85% of our acute care hospitals are unionized. Yep. But I'm worried about the whole rest of the world.
Right.
The whole rest of the nation needs to have that same privilege that we have in Minnesota.
Yeah. And the difference in an ICU bed when you only have one or two patients versus multiple patients is extraordinary.
And the fact that in other states, they have 3 and 4 in their ICU.
Yeah. Another question for you about health insurance premiums. They're set to double for many families next year. I'm really concerned, as you just heard in my remarks, about how these increases will harm families, but particularly how they will harm our healthcare workers and our patients. You've talked in your testimony about the impact of having more uncompensated care, more people without insurance on your patients' health. Can you talk about how nurses and their families will be impacted if their health insurance costs skyrocket next year? Because what we know is as more people become uninsured and as other premiums go up, even if you don't get your coverage on the marketplace, on the ACA marketplace, health insurance premiums are going up. So can you talk about the impact on nurses and their families?
Well, here's the thing is that, and I'm going to come from the hospital standpoint.
Yeah.
Okay? Uncompensated care means the bills aren't going to get paid.
Right.
That means they're going to start closing units, cutting services, closing. We're already seeing where rural hospitals are going to close, but I want to bring something to your attention. In Minnesota, we have 5 level 1 traumas. We have Duluth, Rochester, North Memorial, my hospital, Hennepin, HCA, and Regents Healthcare. Anyway, 5 of them, okay? And we service a 6-state area.
Right.
Okay, everywhere from Michigan to the Dakotas, they all come to our level 1 traumas. We do a lot of Medicaid and Medicare, okay? Right. These other hospitals that do just ortho and babies, yeah, they're not going to take on the level 1 trauma. Just imagine a world without our level 1 traumas.
Thank you for that. I don't want to imagine that world, but it may be coming our way. Mr. Arnold, workers in the manufacturing industry face one of the highest workplace injury rates of any profession. What are some of the top health and safety concerns that you're bringing to the bargaining table, and what priority protections in this area are you fighting for?
Thank you for your question, Senator. Right now, we're mainly focused on economic issues,
We have a high-performance work organization that we have established with the company for years, where departments will elect a team lead, and that lead will lead initiatives that from the workers, from the ground up, they will make their suggestions into team-based improvements. And that could be anything from developing a more ergonomic tool to do a job, to changing the order in which work is done so that it makes it easier to assemble a panel without a wiring harness in the way. It could be anything along those lines. And that is a partnership between the union and the company. The company wants to eliminate that organization. They have asked the union to voluntarily give it up, even though it's in our contract. And I believe they are still asking for us to do that. Our members would like to keep that, not only because there is also a stipend, a 50-cent an hour, $40 pay period, a stipend for being a team lead.
Thank you. Thank you, Mr. Chair.